Hi, and welcome to the ToxFox, a central hub for all things toxicology. My name is Anastasia, and I'm an emergency medicine resident in California. Today's episode is all about snake bites. There are about 25 different species of venomous snakes in the United States. Toxicologists usually categorize them into two groups, the crotalids, aka the vipers, and the elapids, or the coral snakes. Let's talk about the crotalids, since these are more common in the United States. The crotalids include snakes such as the rattlesnake, the cottonmouth, and the copperheads. When identifying a rattlesnake, you want to look for more than just the rattle. These snakes will have a triangular head, a thin neck and thick body, hoods over the eyes, and elliptical pupils. This is in contrast to what you see in non-venomous snakes, which have round pupils and rounder heads. Let's get to our case. You have a 22-year-old male who calls the poison control center from the desert, and he is frantic because he thinks he's been bitten by a rattlesnake. What do you tell your patient? Well, you tell him that he needs to be relaxed, he needs to immobilize his limb below heart level, he cannot have any constricting clothing on such as rings or watches, and he needs his friend to drive him to the hospital ASAP. He should not use any tourniquets, apply any alcohol sprays, apply any ice, or suck out the venom either with his mouth or a kit. Contrary to popular beliefs, these things do not work. When the patient arrives to the hospital, he looks pretty good, although slightly inebriated. His vital signs are he's afebrile, slightly tachycardic, normotensive, and sitting well on room air. You start an IV and give him fluids, update his tetanus, and get the following labs. His electrolytes look great. His creatinine is slightly elevated due to some kidney injury. His white count is 20, indicating some inflammation. His hemoglobin and platelets are normal. His INR and his D-dimer are up while his fibrinogen is down, making you concerned about coagulopathy or DIC. His urine looks clear. He's slightly intoxicated, as you suspected, and he's not in rhabdo. Being the astute toxicology student that you are, you decide to mark his limb in order to help you with further measurements. You mark out zones in the hand, forearm, and upper limb. Remember, you want to do this right because you're going to be checking for edema all the time. After you've marked the limb, you realize that you're in a small hospital that doesn't see a lot of snake bites and definitely doesn't have the anti-venom in the pharmacy. What do? This is where you call Poison Control Center, and they can help you source the anti-venom. They will call your local zoos, because the zoos will have snakes and oftentimes carry the anti-venom. Crofab, or the anti-venom, was created in 2001 using sheep-derived fragments. It's very efficacious when used within the first 6 hours of a bite and contains anti-venom from eastern and western diamondback, Mojave, and cottonmouth. There are some downsides to using Crofab. One, it's incredibly expensive. It costs the hospital about $2,300 per vial, and remember, you're going to be giving 6 vials right off the bat. That's a lot of money. 2, some patients have an allergic reaction to the sheep fragments. Keep an eye out for that. 3, 50% of patients will have rebound coagulopathy despite adequate treatment with Crofab. This is why it's important to have outpatient labs when the patient is discharged. And 4, serum sickness does occur, and this will occur within 5 to 13 days after the vials of Crofab are given. Keep an eye out for fever, rash, and dark urine. One of the things that you want to avoid at all costs is surgical intervention. With so much edema, you're going to start worrying about the compartment pressures, which usually means you'll call a general surgeon and get a fasciotomy. However, in these cases, a fasciotomy will do more harm than good. You really just need to tell yourself, if I see worsening edema, I need to give more Crofab and not get my scalpel. What is this patient's dispo? Had the patient presented completely asymptomatic and with normal labs, it would be reasonable to discharge them home after 6 to 8 hours of observation. However, with abnormal labs, you pretty much have to admit these patients to the hospital. They may need more Crofab down the line. Now that we've talked about the crotalids, let's move on to the elapids, or the coral snakes. Red on yellow kills a fellow, red on black, venom lack. This is a great rhyme to remember your venomous coral snakes. As you can see, the picture on the left is a coral snake that is non-venomous, red on black, venom lack, and the coral snake on the right, red on yellow kills a fellow, is definitely venomous. These envenomations are quite rare and usually occur in places such as Florida and Georgia. 25% of the bites are dry bites. Symptoms include edema and GI symptoms, but the hallmark here are the neurologic symptoms. You'll get somebody who's altered, have cranial nerve deficits, or simply someone who stops breathing. You want to give antivenom 3 to 5 vials. You can give more as needed, or you can also consider neostigmine, which inhibits the degradation of acetylcholine. Remember, all of these patients need to be admitted to the hospital, as they may develop neurologic symptoms down the line. Let's recap. The crotalids are the vipers. You want to give Crofab, the antivenom, which if you don't have in your local hospital, you can find in your local zoo. You want to give Crofab if you see more edema. You do not want to go for the fasciotomy. Keep an eye out for coagulopathy. The elapids are the coral snakes. Red on yellow kills a fellow. Watch out for the neurologic symptoms. Thanks for watching the Tox Fox, and see you next time.